If you've ever been curious about backdoor fun, but didn't know where to begin, I got you. Tonight, we're talking about the ins, the outs, and everything in between.
Somewhere, breathe in some love. Let yourself unfold. Breathe in some love.
Hello, y'all. I'm sorry I'm a little late this evening. ADHD and time, we don't really go that well together, but I'm here, okay? Um, and I'm excited. Excuse me. Last week was fun. If you missed last week, we started the conversation about all the things that you needed to know about backdoor fun and really got into a lot of the sort of myths, misconceptions about it. And so tonight, I wanted to get more into the details. I found like there was a couple episodes ago when I did talked about like the sexual response cycle and women's arousal, and that was really fun for me. It reminded me that I liked teaching. Teaching was the one part of being academia that I really never hated. All the other parts eventually made me want to lay down on the side of the road and give up life. But teaching I always enjoyed. So that is what tonight's focus is going to be, is getting more into some of the nuances and details that I think everyone should know and be fully educated about before they attempt to engage in any backdoor fun. As a reminder, I'm Dr. Nikki. I'm a licensed psychologist and pleasure coach. I'm based in Houston, Texas. And this is the space where we talk about all things related to joy, authenticity, pleasure, liberation for Black women and femmes. Okay. So, as a reminder that this episode, but along with everything that we do, right? This is about offering a brave space to have sex positive conversations about things in a way that is without judgment, without shame, and always with the intention to center pleasure and intensify or amplify empowerment, right? So, this might not be for you, right? You may never be interested in having anal sex. But that doesn't mean you can't learn, right? There's always something for us to learn. So we want to sort of introduce ourselves into this space with a focus on curiosity rather than judgment, and a focus again on pleasure without shame. Lastly, remember, although I am lots of people's therapist, I'm not your therapist if you're not my client. And so this is not direct psychological advice. I am a licensed psychologist. I am not a medical doctor. You know your body and your anatomy best. And if you don't know your body and anatomy best, you should get to know your body and anatomy best. So it's always take what makes sense for you and leave the rest. And we're all good. So last week we really again focused on those top 5 myths that come up for people or that are part of like our everyday conversation about um I'm sorry, anal sex. I got distracted by the comments. Hey, because look, I can't really see them the way I have it set up, but I was like, somebody commented. I'm so excited. Welcome, welcome, welcome. So just as a quick recap, and if I had my life together better, I would have put them, I would have made a little slide to have them up here for future reference. But we talked about myths about anal sex. One, that it's being like that it's nasty, right? That it's like, ew, why would you do that? Like amoral and problematic, that it's unhygienic. So gross. There's poop. Why would you put anything up there? We talked about it being sort of something that it makes you gay if you're a man. And we also talked about that it's painful or hurts every time. And that also how it's not at all like what you see in porn. Okay. That is not at all like you see any representation you have seen on your phone, laptop, uh, AirPlay to your big screen TV that has been for OnlyFans or for any type of entertainment sake. whether it's produced by a studio or not, if it just looked like people were slipping right on in, um, and there was no issue, no prep, no discussion, none of that, that's all fake. That's entertainment, right? So now we want to go and talk a little bit more about, well, if I'm like interested in this, what are you saying that I should be doing, Dr. Nikki? Like, what if is that if porn isn't right, what should we be doing? So, one, I want to take a second and sort of just give us a little bit of education about our anatomy. Again, you know yours best. And if you don't, you should get to know yours best. I have a whole digital course that I created specifically for Black women around mirror work and getting to know what their own vulva looks like, because so many of us have never looked down there. There's so much shame attached to our genitals and the most intimate parts of our bodies. And so it is not uncommon that you're not familiar with your anatomy or what it all looks like and what's normal for you. This is your official invitation to change that, right? To get to know what your body looks like, because only you can then know what works for you, what doesn't work, and what is normal for you and what's not normal for you. Okay. So I want to talk sort of like big picture about the anatomy and why we're even talking about, or people talk about anal sex as even being pleasurable, right? We talked last week about the fact that anal play of any kind is one of the types of play that we can engage in that is like, it's all inclusive, because guess what? No matter your gender, everybody come with a booty hole. It's just fact. And I kind of really just love saying that statement because it's so true. There's so few things that we can say that everybody has. Everybody has a booty hole, right? The fact of the matter is there are lots of nerve endings. So that part of our body comes along with a lot of blood flow. And usually when there's a lot of blood flow, there's also a lot of nerve endings. And so that means there's also lots of opportunity for erotic stimulation. So this is why people have been engaging in anal play for millennia. They're not doing it because it's perverted, um, or some other weird thing, or that they have a pain fetish. It's because it serves a purpose. It serves a purpose of pleasure. And so I want to try to put up some images. Don't judge me for my images. Okay. These were searches of the World Wide Web, and I found ones that were most detailed, even if they're not the most aesthetically pleasing, right? One of these days, I have a vision that for Dr. Nikki Knows, I'm gonna get my own line of anatomical human beings and like make illustrations of them in all different kinds of positions. And they're gonna be like body positive and across the melanin spectrum, across the gender spectrum. And I have my own diagrams, curated, commission, that's the word. But we're not there yet. So I'm gonna pull up some diagrams so that you can follow along and know what I'm talking about, right? So when we talk about anal play, I'm talking about it broadly. And so I'm going to get into what that fully entails a little bit later. So, one, I want us to, in the same way that I always encourage us to be pleasure focused and not focus so much on sex as being a penetrative act, we're going to do that same thing here, right? So, you're going to hear me use the word anal play more than just talking about anal sex, which is specifically penetration of the anus, right? So there's lots of nerve endings there, lots of sensitive tissues, lots of opportunity for erotic stimulation. Um, for people who have prostates, so people assigned male at birth, more often than not have a prostate. Sometimes over the course of a lifetime when they have their prostate removed due to cancer. But most people assigned male at birth have and retain their prostate, even if their external anatomy changes. And so the only way to get to that, and some you might have heard people talk about it as the P spot. We've heard talk about women's G spot. So, and we're going to also talk about the A spot for women. It's the P spot. And the only way you can get to it is a little magic button that lives inside of people assigned male at birth. The only way to get to it is through the booty hole. That is just, there's no other way to get to it. And that's not quite true. You could, in some people, stimulate the perineum, and I can talk about that in a second too. but to get direct access to it, right? Unfiltered, unfettered access, um, you have to go through the rectum. And that is a highly pleasurable, highly sensitive part of male anatomy, right? The similar correlate for women or people assigned female at birth is the clitoris, right? Even though the clitoris still trumps, I hate that that man took that word away from me. The clitoris still beats all the other things because it has the most nerve endings of all the things. So the ability for people with clitorises to have the most heightened and extended and intense and nuanced experiences of erotic pleasure because of it still remains supreme. So let's never forget that. So part of the thrill, the draw, the attraction to, the desire to engage in anal play is access to that prostate, right? And then for some people, like the thrill of the taboo of it, right? Like, ooh, we're doing something we not that's naughty. Like it is not it is not a sort of standard, right? It's not part of the basic package of most erotic play or sexual play. And because there is so much sort of brouhaha about anal play, there can be a little bit of a thrill around it, right? We're doing something different, something a little bit outside of the norm, and being in that heightened sort of mental state around something oftentimes comes along with a greater access to or more intense sense of physiological arousal. Okay. But then we also want to be aware that because of the anatomy of the anus, um, we have to treat anal play differently than we do with either vaginal or penile play. Okay. So, with all that being said, if at any point I'm losing you, going too fast, it's too much, you got questions, just drop me a note in the comments. If you still with me, drop a what's gonna be my signature emoji? Drop a little peach emoji in the comments if you still with me and you're tracking, okay? So let me pull up my first um graphic, okay? So one, I want to talk a little bit about um is this where I want to do it? Okay. So here we have um the right here is what you see from the outside view, right? So when you look at the anus from the outside, you're just seeing, really what you're seeing is the bottom of the digestive system. It is just the very end of your colon. That's what a butthole is. And it has all of those, it looks sort of like um all these like folds and like petals. It looks like um a little cinched, like right, a little knot, like almost. If you've ever seen the end of a balloon that's been tied off at the end, that's essentially what the anus looks like, right, from the outside. This is a cross section of what it looks like from the inside. And the important part about this um, diagram and why I wanted to show it is because we have these external and internal sphincter muscles. So those are muscles. The sphincter are muscles that keep your butthole closed until it's time for you to release feces, right? That is a muscle that you can control in the same way that women control their Kegels. You can also control that muscle, right? If you think about ever having to bear down on something right now, you could, if you get like, whoop, you could tighten it up, right? You have voluntary control over that, right? That is because you're exercising these muscles, okay? And then this is sort of the what's called the anal canal. So when something is inserted in the anus, this is the space that it's going in. Above this, right, way above this, is the sigmoid colon, which is a bend, which is why we just don't have poop coming out of our butt all the time. So to dispel one of the myths, right, that people have about anal sex is that it's dirty or there's definitely going to be feces involved, is that to show that really where the poop lives is at a higher point than where most things that are inserted that should be inserted. So either a toy, a phallus of some sort, a dilator, a butt plug, anal beads, prostate stimulator, dildo, vibrator, or penis or finger. Pick any of those. None of those are typically long enough to get up to the place where you would be interacting with real poop. Okay. However, this area can easily also be accessed and cleaned with a douche, and that can sort of flush out any lingering things that might be there, right? So I wanted to show this so you get an understanding of what we're talking about. We do not learn most of this stuff in school, right? Um, and now how do I get back to me? Okay, there we go. Am I back? I'm back. Hello. Okay. Right. So then I want to just briefly show. Let me know if you have any questions. Again, if you're with me, drop a peach. If I'm going too fast or you have questions or something that wasn't clear, drop it in the comments and let me know. So I'm going to put up here a cross section of what is typical for people assigned male at birth. Obviously, I found a Caucasian picture, and I wish I could zoom in for you all, but I wanted to be able to indicate where the prostate is. So if you look here, the prostate is at the top of the right at the juncture of at the top of the pelvis internally, right? And it is where that nerve bundle of nerve endings exists for people assigned male at birth, right? And so this is the back. So the anus, right, leads out here, and then the prostate is here. And so it's described as like almost like a spongy, squishy sort of bundle of nerves that kind of is like what's the word I'm looking for? Kind of like a bump, right? So if you were using your fingers to digitally stimulate someone that's assigned male at birth that has a prostate, you would feel like a little bump there, and it feels sort of squishy. And you can use different levels of pressure, intensity, and tempo and rhythm to stimulate the prostate for erotic pleasure. Okay, the prostate contains also that's where seminal fluid is contained, right, and contributes to ejaculation. Okay, so we're talking about here, right? So this part here represents your pelvic floor muscles, and again, every human body has those, right? So the internal anatomy is not that different. So there's a set of muscles here that are also used to contract and that we control, that are voluntary muscles. And some folks have more tight ones than others. This is the same reason why some women may experience more discomfort or tension for penetrative sex if those pelvic floor muscles are too tight and there's not enough ability to control and release those. Okay, and then I'm going to show you one more cross section, because anal play is not just for gay men. People of all genders and bodies can enjoy anal play. And I want to talk about, so for people assigned male at birth, talking about sort of the prostate and the P spot is a pretty straightforward, like, okay, I get it, right? Access to that, stimulating that through anal play, through anal penetration. I could see how that would bring a great deal of erotic pleasure. But people, women or people assigned female at birth don't have those. So what's the point? The point is that one, you can experience some stimulation of the backside of the clitoris, or like the clitoral legs, on the backside. Remember, we talked about that a couple episodes ago too. So that's one thing. But then you can also access what's called the A spot, and that's the anterior fornix. I got to put my glasses on to help me find it. Uh, it's this spot right here. That's again at the top of the vaginal canal, and that sits right like at the meeting of like the top of the vagina and the cervix. And so with anal penetration, that pressure that's in this area can stimulate the anterior fornix, and an anterior fornix orgasm is a different type of orgasm that women can achieve. Okay, so that's a bit of the anatomy. I think that that is so important for us to talk about, even if it can be a little bit uncomfortable, or a little like we getting deep, Dr. Nikki, right? But there is really a huge dearth of education about sex and sexuality, and certainly from an inclusive place, right? And so being able to really know what's going on with your body and what's happening in your anatomy gives you a greater degree of control about your own pleasure. And I think that being educated always leads to being more informed, and being more informed leads you to being more empowered. And when you are empowered, you have the capacity to experience pleasure on your own terms in ways that make you feel as safe um, and free as possible. Okay. Again, if you have any questions, um, if it's too much, too fast, let me know. I'm happy to answer them. Okay. So that's the anatomy. Um, what I'd like for you to do is, let's just take a second. And I would like for you to actually like just check in with yourself, to think about, as you were listening to me talk about those different anatomical structures, whether you're a person that has a prostate or a person that has anterior fornix, what does thinking about that part of your body bring up for you? Have you ever, can you right now take a moment to sort of connect with that? Um, to think about energetically where that is in your body. What's it like for you to be curious about that part of your body? And as you are sort of scanning and thinking about it, connecting with that, because it's all you, right? It's yours. What do you notice? Are you curious? Do you want to like go get a mirror and look? Do you want to figure it out for yourself? Do you feel tension or discomfort anywhere? If so, where? What's the sort of underlying narrative that's feeding that tension? Do you feel affirmation or a little bit of softness and excitement? Do you feel arousal? I think being able to slow down and really be intentional about being attuned to our bodies, all parts of our bodies, without shame and without judgment, literally from a space of curiosity and wonder. And even if we come up against some tension or negative feeling, or disconnect, some sort of activation, to not judge that, to be curious about it and let the curiosity speak to us. I think it is when it is not, I think, I take that back. When we do that, as we continue to be curious about ourselves and our bodies and listen and be attuned, the more that we give ourselves the opportunity to have the most fulfilling lives, period, full stop, right? Because when people who are self aware are much more able to be self empowered, self accountable. And it also allows you to then be able to communicate, engage, connect with your partners in a much more intimate way. So I'm going to always, always, always advocate for that internal work first, for that self work first. And As we move on next to talking about the different types of anal play, I will still be encouraging you to do some of that with yourself first. If it's something that you are curious about, if it's something that you tried maybe once with a partner and it was a disaster, it didn't go well, if it's stuff that you've never even thought about, but now I'm making you think about it, I'm gonna always encourage you to start with yourself first. And that doesn't have to start with um, physical engagement of your anatomy. It can really start with that exercise that I just walked us through, right? To sort of really get attuned to and get curious about those parts of our bodies and wonder what they can tell us about ourselves, what they may need or desire, or what they could bring to our lives if we just turn our attention to them. Okay? So let's get into the ins and outs. Let's talk specifically about the types of anal play. And as I talk about the types of anal play, I want to remind us that there is no hierarchy of pleasure, that all pleasure is what? Good pleasure. Say it with me. All pleasure is good pleasure. Put it in the chat. All pleasure is good pleasure. We listen and we don't judge, right? So there's no hierarchy here. As much as I would tell you that there is no rule book that has said that intercourse among heterosexual people is the way, best way to have pleasure, is the same way you're not going to hear me say that penetrative anal sex is the only way that you can have enjoyment with anal play. And quiet as it's kept, and counter to stereotype, not every gay man is engaging in anal sex. We all live in the same sex negative culture. We all have different anatomies that have different uh, limitations and possibilities. And that is true for people who are same gender loving, right? And so um, we want to have an expansive repertoire of behaviors that we can engage with ourselves and with our partners that bring us pleasure. So we're going to talk about different types of anal play. So one is just external rubbing or pressure of the anus, right? Again, that is a sensitive area. And even just some light to moderate intensity rubbing, pressure, some sensation there. Um, you could use your fingers, you could use a toy, you could use other body parts, you could blow on it, you can play with temperature and texture with toys, right? Even just that external rubbing or pressure can be pleasurable for people. Okay, so that's one. Two, we can talk about tossing the salad. I hate that that phrase went out of. I've dated myself. Definitely, I think that is very much a Gen X, maybe elder millennial phrase, right? Um, but it's also more colloquially and commonly known as rimming, right? This is when we talk about analingus is the technical term, right? So using your mouth to stimulate the anus, right? Again, we want to make sure in any of these situations we're paying attention to hygiene and that you feel like you are clean, right? If you're the receiving partner, it's about how you feel, right? That you feel clean and you feel ready to be relaxed to be able to receive that, right? So we want to so we've talked about just external rubbing or pressure, and we can do the same thing. We talk about rimming or oral play, right? You are thinking about the um, mixing up, the playing with um, tempo, rhythm, intensity. Um, our tongues can do a variety of things. It's a pretty nimble little muscle, right? And so different ways you could use it to create different sensations, right? When I'm talking about, obviously this is something you would do with a partner, right? You would have to be even a really talented contortionist to be able to rim yourself. I don't even know. I mean, let me not say it because as soon as I say it's not possible, I can guarantee you it's some porn somewhere that somebody is stimulating themselves orally. However, the average Joe and Jane and Jack, not doing it. Okay, so this is something that happens in partnered play, um, and you want to be communicative, right? You want to be attuned to your partner. You want to see what is working for them and what isn't by being energetically attuned to them. And then if you are the receiving partner, you want to be doing this in a context and space where you can advocate for yourself and articulate what is feeling good and what isn't, what's feeling really, really good and what you want more of, and what is just kind of bleh, right? So the communication, right? We always want to be attuned to that and honor that and highlight that. And then we can talk about fingering, so digital penetration, right? We want to have clean hands, clean fingers, clean those hands, right? We don't want long acrylics. We don't want long unkempt nails. We don't want dirty nails, right? Clean hands and fingers, okay? Because if we're going to go in there as a reminder, the reason why that part of your body is as sensitive as it is because of all of the blood flow nerve endings that are back there. And also the skin, I forgot to mention this. The skin is more thin in that part of your body. And that is especially true for people assigned female at birth, right? So be gentle, gentle touch, okay? Gentle hand, right? Clean, not sharp, no rings, like nothing sharp, right? We want to use our good common sense. Be gentle with that part of our bodies. Be clean with anything you put in there, right? Be clean with your mouth. You can get a little mouthwash in there. Make sure it ain't no extra bacteria just floating around, right? And the same thing, we don't want to go from rimming to vaginal oral stimulation or to kissing, right? We're not trying to move from the booty hole to nothing else with our mouth, with our fingers, with our penis, with our toys, okay? If it touches the booty hole, it stays off the shelf until it's clean, okay? Let's be clear about that. So we've talked about external rubbing or pressure. We've talked about oral play, causing the salad. We've talked about digital penetration. That gives you digital penetration is the human to human, body to body contact that is the most what's the word I'm looking for? Nuanced, uh, sensitive, most control. You working with me, right? Your fingers can do what you need them to do with a little bit more dexterity, right, than a mouth or a tongue, right? And the numbers of fingers that you use, how you move them, all of those things, right? So you have more possibilities, more potential, more control, and skin to skin, human to human contact with digital penetration that is also far less likely to feel like it's too big of an intrusion for it to be painful. Okay. It could still be uncomfortable for some people. Again, this is where you have to articulate and advocate for yourself, why you need to be attuned to your partner and check in with your partner. Tops check in with the bottoms, bottoms checks in with the tops, right? Giving partner check in with the receiving partner check in with the giving partner. It's a two-way street, okay? So clean fingers without sharp nails and rings and all types of other stuff, that can give you, I think, the biggest bang for your buck, okay? And then we have toys. Toys come in a wide variety of sizes, shapes, and goals. Why am I having this? Is perimenopause, y'all. Don't judge me. um, oh my God, functions. That is the word. My goodness. Toys come in a wide variety of shapes, sizes, and functions. And to be clear, there are specific toys for the anus, right? Just as like there are specific toys for vulvas, specific toys for vaginas, specific toys for penises, there are also specific toys for the anus. So we're talking about anal beads, and these are like it's a string. Oh my God, there is a movie. What is that movie called? I think it's called Boys. I'm gonna look it up. There's a movie that I watched, and it has early teen boys. I really want to say they were preteen boys. I don't know how they filmed this movie. Because and it's 2010 something. Preteen. The whole movie is about this set of friends that are boys, and they're in eighth grade, I believe, or maybe freshmen in high school. And so they're right there at the cusp of like the beginning of their sexual awakening as adolescents. And one of the boys goes in his parents' room and into their sex chest and pulls out anal beads and gives them, because he doesn't know what they are, he gives them to the girl he has a crush on at the playground because he thinks it's like jewelry. It's so hilarious and uncomfortable and weird and something totally goofy that a 13, 14-year-old who was ignorant would do. Um, so that is what came to my mind just now, talking about anal beads. So anal beads are, they can be made out of a variety of different material. Usually they're silicone. And so they're and sometimes they are flexible and sometimes they are not. And so they include little um, circle little beads, little circular balls in increasingly large sizes. So from small to larger, that are all attached together, right, like in a string, and they can be inserted into the anus and used for anal play. They can be used alone. They can be used with a finger. They could be used with another penetrating toy or with the penis, right? So toys include anal beads. There's also butt plugs. They come in a variety of different sizes and colors and shapes and all types of things, decorations, and also a variety of different materials. You can find butt plugs made from wood, polished, sanded, sealed wood, from glass. Borosilicate glass is the strongest, least likely to hurt. Um, Silicone, um, um, uh, metal, right? So, butt plugs. Whereas anal beads are typically used to sort of um, move in and out to stimulate in that way, with the different sizes bringing along different stimulations. Butt plugs are usually um, they're inserted once and sort of left there, right? Um, I won't digress more about that. There's also um, prostate massagers specifically, right? And they could also be anal vibrators. The reason why I'm being specific about that is that there are certain things that should never go in the anus, ever. Nothing sharp, nothing that can break, nothing that is porous, nothing that can create a vacuum, right? So, like, not an open ended soda bottle, okay? Um, we don't want things going up there that should not be up there, not light bulbs. Listen, you talk to any emergency room doctor, you just go on TikTok or even go on YouTube and do a Google search for emergency room um, rectum, emergency room anus. You would be shocked and amazed the things that human beings have thought were a good idea to put up their butt. Don't do that, because you will be embarrassed. Because here's the thing, that part of your body is designed for things to go one way, the way that typically down. The way that we're talking about using is counterintuitive, counter pressure to the body. So if you put something up there that's not designed to go up there, or it's not your finger or attached to your body and it can't come out, baby, it will get sucked up there. You know how, like, you used to go to the bank, or even maybe if you go to like a drive-through pharmacy and they have that tube where you put the little canister in there. That's what your booty hole is going to do to something that does not go up there. So when we talk about prostate massagers, we talk about anal dildos, we talk about butt plugs, we talk about anal vibrators. They are specifically designed to prevent them from getting sucked up by your booty hole. Okay, don't say I didn't tell you. Don't say I didn't tell you. Don't you go to nobody's emergency room with a light bulb up your booty and say, Dr. Nikki told me to do it. I did not. I said the opposite. Okay. Toys designed specifically for booty holes. Okay. And you can find them easily on any place where you go to buy your toys. Um, they will be specifically labeled. Okay. And then there's penis, right? Good old fashioned erect penis or a strap on, right? The thing, and again, this is for anyone, right? So this allows anyone to have anal play, penetrative anal play in a way that is fun and exciting. Strap-ons come in a wide variety of sizes, shapes. You can even get strap-ons that are like fantasy strap-ons, right? Like alien tentacles or dragon penises. Like pick a thing, right? If it's your kink, somebody else has the kink and they've thought of it and it exists, right? So you can have a lot of fun with that as well. Obviously, the larger the penetrating um, um, thing, the more stretch and prep you have to do. So now that we've talked about all the different ways you can stimulate it, let's talk about how to do it the right way. And first and foremost is going to be lube, lube, lube. I'm gonna tell you something. There's never too much lube. It's no such thing. It's no such thing. It's no such thing as lube, as too much lube. So sorry to tell you that, right? And when it comes to any kind of penetrative anal play, it's non-negotiable. Spit is not lube. Spit is not lube. Saliva is not lube. Okay. Water is not lube. Vaseline is not lube. Coconut oil is not lube. We're talking about lube. And you really, it's up to you to decide whether you want a water-based or silicone. Different lubes do different things, okay? Even when you're talking about your fingers, we want to use lube. We're talking about toys, we want to use lube. We're talking about strap-ons, we want to use lube. We're talking about a penis, we want to use lube. We're talking about a condom-covered penis, we still want to use lube. We want to use what? That's right, lube. Never too much, okay? Never skip it. Use it before, during, and after, okay? Don't be afraid to use more, right? Because as you're creating friction, no matter how you're stimulating it down there, as you're creating friction, again, you're talking about skin. So the body is going to absorb it. That friction is moving it around. So feel free to reapply throughout play. And then I've talked about this, but let me be specific. We also want to talk about communication. Communication is so key and heightens any sexual experience, but it is especially important. We're talking about anal penetration, okay? And we want to have consent, direct and explicit and enthusiastic consent. And again, we talk about consent as not something that's one and done, that it is an ongoing active process, right? So we're going to consent to engage in anal play and be specific in what we're consenting to, right? I consent to rubbing, but I don't want digital stimulation. I consent to digital stimulation, but I don't consent to rimming. I consent to digital stimulation and a toy, but I don't consent to penetration, right? Or a strap on a penis, right? Be very specific and then have ongoing check-ins, right? And stopping if ever needed. If things don't move from discomfort to comfortable and pleasurable, then it's stop. And that's it, and that's all. And we try again another day if we want to, or we never try again. We don't push past anything. We don't ignore our bodies. We are listening to our bodies and communicating with our partners. When we are the top and the giving partner, we are listening to our bodies and our comfort level, and we are attuned to our partner and we are checking in with them, okay? And there's nothing wrong with trying again later without any shame. There is no failure in sex unless it's without consent, and that is not sex, that's about power. in assault. Okay. There's no failure. We just try again another day, a different way, in a different state of mind, right? The other thing that is necessary is we've talked already is about cleanliness, right? Um, and foreplay, arousal, stretching. We want the butt to be prepped for it. Let me tell you something. I read a lot of romance that has erotic qualities to it. I read a lot of LGBTQ, a lot of like MM, fantasy trans I read a lot of books that have a lot of anal play in it. And it never ceases to amaze me that in the book, the standard practice is one finger, two finger, and the person is fully stretched. And again, lies and untruths. In the same way that you can't believe everything you see on porn, you can't believe everything you read, right? We do want to engage in stretching if we're going to have penetration, and that can be done digitally. It can be done with a dilator. It can be done for fun with a butt plug. That's not the intention of a butt plug, but it can be used appropriately that way. But we definitely want to make sure that the person that's receiving is fully aroused, that they are fully in their body, because we want them to also be fully relaxed. If it's you, you want to be aroused. You want to be fully in your body. You want to be turned on. You want to be tuned in to the moment and with your partner. And we still need to engage in lube and stretching and patience and going slow. What's the rush? Everything else is a rush in life. Everything else is a rush in life. If you can't slow down and have connected, attuned, pleasurable sex, I want you to reevaluate some things for your life. Okay. So we want to go slow. And we want to be relaxed. You got to be in the right mindset. That's why it's got to be something that you choose. It should not be something that you do out of obligation. It shouldn't be done because your partner has been pressuring you to do it. I don't care if it's his 50th birthday, his 75th birthday, if it's your 15th anniversary, if he cheated on you and you think that if you just none of that it's all bullshit. It's all contrived. It's all a construction. You should not engage in any anal play unless you are actually very enthusiastically curious about it and or in the mood for it. Okay? There's no way that you should be pressured into doing it. So being in the right mindset and then being able to relax, and that also requires you to feel safe. Not just safe with the partner, but in the environment. Is the environment welcoming and one that allows you to fully relax and unclench, quite literally, right? To let your guard down, to be fully in your body, right? So all of that connection, the environment, your sense of safety, your ability to communicate, all of that matters as much as the right technique, knowing the right anatomy, having all the right pieces in place. I cannot stress that enough. Okay. All right. Have I lost you all? You were like, this is too much, Dr. Nigga. It's too much. I hope you found it very, very informative. Okay. So if you have any questions, you want me to go back over anything, just drop it in the chat and let me know.
Let yourself unfold. Yeah. Let yourself unfold.
So this week's Dr. Nikki Knows is about I want to try anal play, but I don't know how to bring it up with my partner. I think this goes back to you having a open relationship, right? A sense of empowerment, knowing how to advocate for yourself sexually. I don't think it's any different than wanting to try anything else or explore something new or different with your partner. That you start from a place of curiosity, right? And by that, I mean, one, part of what needs to be there foundationally is that you and your partner both know that you are in a healthy, productive, calm, grounded state of mind, right? And that you want to talk about something that is vulnerable to you, but something that you are hoping to put on the table to bring more connection and intimacy, regardless of the outcome, right? That putting that question on the table is seen by both of you all as an opportunity to build a deeper connection and a greater sense of intimacy, right? I don't encourage you to do, in fact, let me say this way, I want to advocate for you not to bring something up like this in the middle of sex. If it's the first time that the subject's ever been broached, in the middle of any type of sexual play, right? That it should be done at a time and place aside from in that type of moment, right? Think about how vulnerable you feel being naked. So you want to spring something else on your partner when they're feeling the most vulnerable and think it's going to go well? Probably not, right? And as I hope you just took away from the other part of tonight's episode is it requires a lot of thought and prep, and some sort of tools. You need some things on hand, right? So this isn't just a spontaneous thing, right? So choose a time and a place and a state of mind where you know your partner can be receptive to the conversation. And I think being able to lead by saying, this is something that's been on my mind and it's not easy for me to say. I'm a little worried about how you might respond or think about me differently. To put that on the table, right? To say, to give your partner the alert that this is something that you want them to be fully paying attention to, so that they can be attuned and to be sensitive, right? To take it seriously, not too seriously, but to know that you are extending your vulnerability to them, right? And then this piece around curiosity is the mindset I want both of you all to be in. It is not an ultimatum. It's not it's not a expectation. I want to do these things and you're my partner, so I have to do it. Like none of that. It's here's this thing I've been thinking about. I've been curious about for a while. What do you think about it? What would that look like? If your partner has reservations, if you have reservations, you're curious, but right, you can be curious and have ... right? To have a conversation that is a dialogue where there is no expectation of an outcome at the beginning. That's what I mean about that. And also to give yourself and your partner permission to not have to have an answer at the end of one conversation. That maybe it's a conversation starter and we sit and we think and we reflect and we do the pleasure practice. That's coming up in a second. We really sit and reflect about what that means for us. What do we think about that? And come back to it again. Okay, talk about what we're willing to try. Maybe have your partner come watch this episode. Okay, like don't think about it as I say it, it must happen, or if it doesn't happen, I've been rejected, or we got to act on it now, right? Like give yourself breathing room, give yourself as many options on the table, as many points on the continuum, right? To look for the gray. That's what I think you should do. And if the answer is no, you can still be curious about that. Tell me why, right? I'm okay. That's where you are. I respect that. Can you tell me why, right? If you feel judged in the conversation, then we lean into curiosity and we can say, I feel like you're reacting to this in a way that is shaming for me. And that doesn't feel good. Can you give me some more feedback or information about how you're responding right now? Do you feel judgmental? Because it's coming across that way, right? The more that we can lean into curiosity about it and take a curious stance, the better it will be. So I hope that helps. Okay, and then last thing, let's get into it.
Yeah. Let yourself unfold.
So this week's pleasure practice, and I'm going to actually put it in the show notes for later, but this week's pleasure practice is a journal prompt. I would like for you, if you have watched these episodes and been like, right? Whether you've ever had any anal play, whether you've had anal play and it didn't go well, whether you've been curious about it, wherever you are in the journey, I would like for you to sit and write in your journal prompt and really, if you was about that life, you would have the pleasure pursuit and you could write about it in here. You could journal about your experience in here. Okay. Available at drnikkiknows.com/shop. Get yourself the pleasure pursuit. It's a great place for you to keep up with all the episodes that are around eroticism and pleasure and check in with yourself and track your own growth in your pleasure journey. Um, but the journal prompt is going to be, what are my honest thoughts and feelings about anal play? Not what society has told me, what I've internalized, what I assumed I believed, what I've heard other people say, what I worry about other people would think about me if they knew, but what are my honest thoughts and feelings about anal play? And then what judgments, curiosities, or fears do I carry in my body about anal play? And the third is, how can I find more curiosity and compassion and appreciation for myself with these thoughts and feelings? Right? So the last one is, how can I engage these thoughts and feelings, my honest thoughts and feelings about anal play, with greater compassion and curiosity for myself? That's the practice for the week. This is more of a mental practice than it is a physical practice, okay? Again, I will put it in the show notes for you to revisit later, so you can write it down for yourself. I would love for you to go over to the community tab on my YouTube page and let me know what you came up with, what you thought. Like, how was it for you to even be curious with yourself in that way? Lastly, before we wrap up, I want to remind you about my Voxer group, the Pleasure Sanctuary, that you can apply to get admitted to the Pleasure Sanctuary. It is a brave and sacred space for high achieving Black women to talk openly about all things related to pleasure, eroticism, joy, authenticity, self compassion, intimacy, and liberation. And so I do screen the members, so we keep it a brave space, but you can apply using that this web address. I'll also have it in the show notes as well. There is a free broadcast channel, and there's also a paid membership of only $15 a month, where you get to interact and engage with other women. So it's more like a small group coaching space. And then be on the lookout for a workshop that I'm going to launch in person here in Houston. That's coming up at the end of September. I'm super excited about it. That's all I'll say for here now, but be on the lookout for that. So if you're not signed up for my mailing list, please sign up for it. You can access it by visiting my website. I'll also put a link to it in the show notes. And last but not least, if you're watching this live or watching this in the month of August, early September, I am still accepting new individual therapy clients. I'm all full with my couples clients at this time. I only see a proportion of my practice for couples because couples are a different level of energetic work for me. But I do have a few more slots for individual clients if you're looking for a therapist, especially if you want to focus on your intimacy, relational, and sexual wellness. And then lastly, I will remind you that pleasure is your birthright, whether you're going through the front door, the back door, the side, okay? That when you meet yourself with curiosity, compassion, and joy, there is no limit to the extent and the depth of pleasure that you can experience. Okay. Thank you so much for staying with me. I know tonight's episode was a bit longer than normal, but I have some details to give to y'all. If you had to leave, you know the show will be up for full viewing on Saturday after 12 p.m. Central Standard Time. And as always, please be a friend to me and tag a friend, tell a friend. Make sure you hit that subscribe button. Make sure you hit that like. Make sure you hit that share. Make sure you hit that comment. I am at 217 YouTube subscribers. My goal is to get to 500 by the end of this year. Can you make that happen for me? I would love to continue to be able to do what I'm doing here with you. And I would like for as many people to be involved and be a part of this community as possible. Okay. Like, share, subscribe, comment, all the things. Have a good evening, a great weekend. And I will see you here next week, Thursday, 7 p.m., live with Dr. Nikki Knows.